Okay. All right, now we're coming to the next focus of this discussion, and it's basically you need to find a biological dentist that will remove the amalgams using a safe mercury amalgam technique. Thank you very much. Okay, good. You don't want to go to a dentist that does mercury free. I think we've already discussed that. It has to be a safe procedure, whatever is done. One amalgam filling weighs about 1 gram. That's just like a small occlusal. So that 1 gram of amalgam contains half a gram of mercury. So the average adult of a greater age has at least 10 fillings of half a gram of mercury. That means 5 grams of mercury are available. Let's put this in a way that everyone can understand. Half a gram of mercury in a 10-acre lake warrants a fish advisory. The lake's closed down for any fishing. So it's a pretty significant level. Mercury comes in several forms. You've got the elemental, and this is the metal form, either as a liquid or a vapor. 80% can be taken up by the lungs. The elemental crosses the blood-brain barrier and has a moderate uptake in the intestines. Inorganic mercury, which is formed by an oxidation, so you get your salts, has a poor uptake in the intestines, and it causes inflammation. So that's about all that it does. It does not cross the blood-brain barrier. Methylmercury is a good one. It's formed by bacterial synthesis in the oral cavity as well as the gut. 95% of that is taken up in the intestines. It has good mobility going through all the tissues, and it does cross the blood-brain barrier. Ethylmercury brings up the vaccine issue. Thimerosal is ethylmercury. It's a synthetic form. It's antimicrobial, and it's the preservative in vaccines, which is 100% absorbable. Crosses the blood-brain barrier, and it breaks down back into elemental mercury. According to the EDA, dental amalgam is a safe, affordable, and durable material that has been used to restore the teeth of more than 100 million Americans. It contains a mixture of metals such as silver, copper, tin, in addition to the mercury, which bind these components into a hard, stable, and safe substance. Dental amalgam has been studied and reviewed extensively and has established a record of safety and effectiveness, as we well know. There are many people who are allergic to mercury in its neutral or its ionic form. Research has put this figure up as high as 10% of the population. But just remember, mercury is poisonous for 100% of the population. It is a poison before going into the mouth. It is a poison after it is removed from the mouth. But it's safe when it's left in the mouth. Okay, what comprises the fillings? You've got a trace of zinc, 2% copper, and the high copper fillings came in approximately in 1978, which added to the property of hardness of the amalgam. 13% of the amalgam is tin, 35% silver, and 50% is mercury. Some patients do suffer more from the mercury fillings. This is due to a genetic susceptibility, and this is from individuals who've inherited the APOE2, 3 or 4 combination. Patients that have 2 APOE2s, one from each parent, are much less likely to get Alzheimer's or have issues with mercury. excuse me, APOE2 is more protective than APOE3 against early onset Alzheimer's and other diseases. So the APOE2 has two cysteines or sulfhydryl groups. APOE3 has one arginine and one cysteine. There it is, sorry. And so with the A3 combination, you're missing the sulfhydryl group. Then you go to the APOE4. These are the most susceptible patients, and they have no sulfhydryl groups from the cysteines because they are both arginines. And there's just a repeat. APOE2, two sulfhydryls that combine mercury. The E3, you've got the arginine and one cysteine. APOE4, no sulfhydryls. So these are the people that are very susceptible. Part of the slide is missing. Oh, there it is. Okay. So this is what happens. We've got the components of a dental amalgam filling are transported to a dental office in a hazardous waste container. Waste container is opened by the staff or the dentist. The amalgam is mixed, and how much of it is mixed without proper protection. In the old days when I was placing mercury, I am guilty of that, we had a little tank or a box, and in the bottom we had a tray, and it had a solution in there, and then you had to close the lid before you mix the mercury, and that would supposedly absorb the mercury vapors when that was being filled. So we're talking early 80s when that stuff was out. So certainly it was a good dental company thing to sell, but somebody put that out there, so they knew of the dangers even then. The mercury's picked up into an amalgam well, which usually is metal and which will actually keep the mercury onto the well. So you've got a potentially contaminated container. Dentists wear a mask. They use gloves. They don't really touch the mercury filling. And the room is supposedly well ventilated. Materials placed in the patient's mouth. It's condensed and it's carved, and all those little bits and pieces are dropped all over the patient's mouth to enhance the look of that wonderful amalgam filling. The extra material is suctioned and collected in an amalgam trap in the suction system. And then that extra material is placed in a glass bottle, and it's covered by water and tightly sealed so no vapor can escape. And these are the guidelines of the Environmental Protection Agency and the American Dental Association's best guidelines for disposal and recycling of the mercury. The Agency for Toxic Substances and Disease Registry lists mercury as number 3 in the toxic materials after arsenic and lead. According to the American Dental Association, this toxic substance is only safe to store in the mouth. The American Dental Association does have a vested interest and they've owned 2 patents on mercury amalgams since 1977, 1978. There have been moves to diminish exposure of patients to different toxic substances. California has Proposition 65. This applies to mercury and nickel. And the law states that if you expose someone to an item that can cause a cancer or birth defects, you have to inform them. It doesn't stop you from using it, but you have to inform them. Patients have a right to know. Doctors have a right to know. This covers mercury and nickel. In the summer of 2000, a judge in Maryland ruled that the Maine State Board of Dental Examiners violated a law by prohibiting dentists from discussing the risks of amalgams. That has been followed up on, and dentists are allowed to talk about amalgams as being not safe. Nickel is carcinogenic. It binds to oxygen, nitrogen, and sulfur-containing biochemicals. It's an immunosuppressive, and it inactivates natural killer cells. It affects the visual areas of the brain. It's a compound which is found in a lot of the orthodontic metals that are used. Copper increases the carcinogenic activity of nickel. And the nice part about the copper is, as it's making those harder amalgams, it increases the release of mercury vapor, more than 50%, into the patient's mouth. And copper is in 90% of the dental golds, the garbage metals that we use with the golds, because the good golds are too soft to be usable. Up to 1% of the population is allergic to titanium. It's a hapten which can stimulate autoimmune reactions, and screwing the metal in the jawbones can influence the meridian systems. So all of a sudden you've got some different electricity passing through the system, causes more galvanism, and enhances the release of more ions with the metals. So here we come to the crux of what the discussion is now. We're going to discuss safe amalgam removal protocol. So there's some components that are important in this. You've got the exam history aspect. You've got the health status of the patient aspect. You need to establish treatment plans, get your informed consent, and protect the patient, the staff, and the dentist. So in my office, the first session that we have with the patient is an information gathering session. We don't do any diagnosis, it's just information gathering. So we have diagnostic x-rays, and the rules are they have to be within 1 year. And if they're copies from another office, they need to be diagnostic. They need to be readable. We get a lot of things sent to us via digital transportation, and you can't read the darn things. So the patient knows even before coming that the x-rays may need to be redone if they're not clinically adequate. We need a full medical history, and we document the pathology of each amalgam associated tooth if they're coming in specifically for mercury removal. And this is to CYA. So if that amalgam is cracked, you got to write it down. If it's corroded, you write it down. If it's marginated, you write it down. If you've got, from the expansion on the amalgam, if you've got mesial and distal fracture lines, lingual and buccal, write it down, document it. I mean, my hygienists do the initial gathering, but all that stuff is documented because you've got to have a rationale for removing that amalgam. And then we also document any tattoos that are associated around the teeth. And then we give them a book, which IAOMT puts out, The Dentistry Without Mercury. and that's their homework assignment. And every amalgam removal patient gets that, is told to read it. And I would say probably we get a 99% success rate that they do, and it gives them something to bite down on. Then the second appointment, we bring them back in for a consult. And then at that point, we go over the health status and discuss some additional testing. Basically, from the original health history that we've gotten, we assess the patient as being a class 1 or a very healthy patient. And we don't worry about those chaps so much because standard protection will take care of them. Class 2 patients have minimal health problems. But you have to mind all your P's and Q's in these patients because sometimes there's some undiagnosed conditions that are there. The class 3 patients are acutely or chronically ill. Don't do anything to them. Refer them to a licensed healthcare provider and get them prepped before you touch them. They have to be cleared and sign documentation that they are cleared from their provider, that they're physically able to stand the procedures that you're going to be doing. So if you've got someone that's got extreme kidney problems, they got to be cleared because you can run yourself into a lot of problems if the excretion organs are not functional. And you wouldn't want to kill a patient. So this is the separate consultation appointment. In that appointment, we do take galvanic currents on the teeth. We use a readometer. We give the patients test kits so that they can get the biocompatibility testing done, and results come back fast. And then we can do ancillary tests if we've got some concerns like melisa or metal toxicity, but that is part of the support staff with the licensed healthcare provider. We have a question and answer session, and then we go over pre-treatment instructions, as well as go over the actual procedures that we're going to be doing with the patients in the rooms. Patients do get to see all the equipment and just basically walk through the procedures. So the electrogalvanism, that's an important facet. Voltage is the amount of potential energy that electrons have relative to another point, like height. It would be how fast would water fall from point A to point B, or point B to point C. It is a measure of how much force those electrons are under. Amps measure the current, and it's a current or rate of flow like a river. So a big river can flow fast and release a lot of electrons. A little river flows smaller, and those electrons move more slowly in the circuit. The electrical current reading gives a general idea of the speed of the electrochemical reactions occurring on the filling of the surface of the filling. The mouth is an electrical battery. So in the presence of saliva, dissimilar metals cause galvanic action. So if you've got a gold crown over a silver filling, you got a really great battery. It's awesome. And actually the old instructions for mercury fillings said never place gold over amalgam. And that's in the usage instructions you used to get with every packet, which is rather interesting, seeing the amount of gold crowns we do see placed over mercury fillings. A gold alloy bridge over mercury can release 300 or 30 micrograms a day, which is 101 milligrams over 10 years. The gingiva adjacent has had levels reported up to 200 parts per million. Root tips measurements have shown 41 parts per million. These currents enhance the release of silver, tin, copper, and zinc through the currents. Mercury accumulates in fibroblasts, macrophages, and multinuclear dime cells, occurring in the connective tissue, the blood vessels, the nerve sheaths, and the basement membranes of the mucosal epithelium. It's dispersed to the gums. You had your levels of around 200 micrograms. To the base of the teeth, 41. And these can cause systemic lesions and health effects. Currents over 5 microamps can cause significant problems such as headaches, migraines, nausea, and dizziness. Electrical potential differences of over 50 microvolts are associated with leukoplakia, lycoplanus, or toxic and allergic reactions. How often do you see some lower wisdom teeth with nice big amalgams on the sides and a white spot lesion on each side? I've checked some of those out, and we've had them one side biopsied, and it's actually shown up to be a leukoplakic or lichen planus. Then the other side, and of course we've removed the mercury, but on the other side, we've just removed the mercury and the lesion's totally resolved. So that is an amalgam type of allergic reaction, and there are references to it even in the ADA literature. The potentials from a mercury filling could range from minus 417 millivolts to 150 millivolts. It is believed that negative potentials are more pathologic than the positive. Patients with autoimmune conditions like MS tend to have high negative readings. So electrogalvanism gives a general idea of the speed of the electrochemical reactions occurring on the surface of the filling. The brain operates from 7 to 9 microamps, and that's 1,000 times weaker than the currents coming from the non-precious metals. So basically, you get an interruption with the energy flow to the brain, a negative impact on the autonomic nervous system, a negative impact on the energy meridians, and this may be a factor for energetic imbalances in areas which are remotely located from the mercury fillings. And that's where your whole meridian charts come in, and it's amazing the correlations you see. Some of the patients I've done mercury removal for, you'll get a quadrant done, and all of a sudden you get this bizarre response, and they'll jump up in the chair and say, "My leg pain is gone." Just like that. Right in the chair. So with that type of patient where you do get that kind of reaction, a lot of their problem with the mercury is from the electrogalvanism. So you've just cleared out that whole current. Healthy gold crowns, which are crowns that are not breaking down and they have no mercury underneath them, or composite restorations usually register a low positive reading. So if you get a negative charge greater than a -2, it's an indication that there's breakdown going on, because the electrogalvanism measures the calcium migration. So if you've got a filling that's breaking down, you'll get some differences in the current reading. And if you've got really high electrical readings on a tooth, such as a titanium implant and a gold crown next to it, it'll really up the electrogalvanism. Greater negative readings. So electrogalvanism reflects the conditions that encourage the conversion of ordinarily toxic mercury into methylmercury. And you'll remember methylmercury is the one that is changed by the mouth bacteria, and it's 100% absorbed by the blood-brain barrier. So the higher the amperage in the negative electrical mode, the more conducive the environment is to the conversion into methylmercury. Positive charges on the restorations do not indicate safety. They just indicate that the toxins are being released more slowly. The brain operates on 6 to 9 nanoamperes. So here you get the all-encompassing things of dentistry. You've got fillings, crowns, and braces. Can increase the current to over 100 microamperes. So close to the brain, no wonder so many people function better when the excessive electrical current is removed. Gold in contact with amalgam constitutes a short-circuited permanent galvanic cell, where the electrolytes are constantly renewed. Friction and heat causes a rapid increase in the amount of mercury released. The levels stay elevated for more than 90 minutes and then gradually ease off. This is really bad for those that like us that like to eat, drink some hot coffee, and then chew gum for the rest of the day. We just keep that battery going. When the gold is in the same mouth as the amalgam, the battery is created. The saliva is your electrolyte. There will be steady movement of electrons with currents that are in the order of 1,000 times greater than what your brain functions as. There's an accompanying fourfold increase in the amount of mercury from all the fillings in your mouth, 24/7. And this is a cute little cartoon. It just kind of puts it all together. Electrogalvanic devices measure the microamps, which determine the ions leaving a restoration. Every microamp is 3 times 10 to the 12th power of ions leaving the restorations. A readometer can be used to measure the electrical charges. Normal readings, i.e. non-pathological readings, are from -2 to +2. Carrier susceptibility is related to the number of calcium ions which are migrating with the metallic ions from the mercury. Dental amalgam is electronegative. This is a picture of a readometer. This is put out by Hal Huggins Company. This is the oral potentiometer 2, which is another type of device to measure the galvanism. Comparative prices, the Pertec is $19.95 and the other one is $850. The Matrix readometer is getting hard to get replacement parts for, and it tends to have batteries run out as well. The next part of the preparation for the mercury removal is the treatment planning. No, I can't work it. This is an organization of the quadrants. So we have to decide how we're going to remove these mercury fillings. So basically 4 quadrants in the mouth: upper right, upper left, lower right. Then what we do is we take the highest electronegative readings. That is quadrant number 1. And then we take it progressively to the various quadrants. If you've got a patient who's got leukemia or a Lou Gehrig's disease, you should remove the amalgams in an absolute sequence, going from the most electronegative. So you're going to be jumping around on quadrants. These patients are best done under sedation, where you can do that, because there's some rules if they're not. If a patient's on sedations, you can jump your quadrants from right and left and cross the midline. If the patient's not under sedation, you cannot do that. So that way, those patients do need to be sedated. If you're breaking it up in different quadrants, you try to do a different day of the week for each session. And that's an absolute rule in my office. And you're basically trying to remove some aspects of the immune memory. For example, I guess my own example's the best. I only had Thursday afternoons free to get my mercury removals done. And so every Thursday, I'd be getting another quad of mercury removed. For 3 years, I was sick every Thursday, without fail, because my immune system remembered what happened. And the stuff was removed safely, but it was a memory. And now I'm down to a 1-year anniversary, so it's not as bad. So I can take 4 weeks of just feeling mildly ill, but your immune system does remember and prepare you for the shock of another onslaught going in that cellular memory. If a patient is not sedated, the appointment should not be longer than 2 hours. And complete the treatment within 4 weeks if possible. The patients tend to do better if they have biological support at least 1 to 2 weeks before amalgam removal. It seems to condition the body and encourage the excretion of the unwanted mercury and enhance tissue repair. And the excretion of the methylmercury and inorganic tends to increase if the supplementation is started prior to. And that's where your licensed healthcare provider, your support staff really come in handy, because they take that from you. It's impossible as a dentist to do all these procedures and try to control what you're doing in the office, and then also do the full role of nutritional counseling, and that you don't have the time to do it. The patient shouldn't be given any oral vitamin C before amalgam removal. It interferes with the duration and the potency of the anesthetic. We do give the patient buffered or lipospheric vitamin C after the removal. If you can get them to have an intravenous vitamin C, that would be wonderful. I live in the Northeast. We don't have a lot of people that can do that, because with our naturopathic boards, they're not allowed to give intravenous nutritional supplementation. So in my office, I've had to just give them, I use the Live-On lipospheric. And each patient's, yes. For the vitamin C? At least 24 hours. We prefer 48. And every time we've had someone come in, we've got them draped, the works, and we find out that they don't have anesthesia. They've taken their vitamin C. You know, it's unbelievable. And this is in regular real patients too. So we try to be really forthright with informing the patients. So biological support then, it includes some high quality multivitamin mineral complexes and the multiminerals, and that improves the efficiency of the cell transport membranes. We like them to take digestive enzymes and chlorella, and we highly emphasize no cilantro prior to removal. And you'll find, just discussing this stuff with the patients, a lot of times they say, oh, I just can't stand cilantro anyway. But that's because they're mercury toxic. And then after they've had it done, all of a sudden they can start eating cilantro. Cilantro is a mercury mobilizer. So basically it grabs the mercury from everywhere in your body and it's just shifting it around. And it does not enhance the excretion. Well, it does enhance excretion, but it's the shifting around that you don't want prior to mercury removal. Chlorella just enhances the mercury removal. And then a repeat on the vitamin C, because you can never repeat that enough. And then some other things that are nice to add, but patient compliance is not a great thing with taking supplements. The more you ask them to do, the less they take. So if you've got a really, really motivated patient, make sure they're taking alpha lipoic acid, methionine, whey, chylate garlic, NAC or N-acetylcysteine, and that's from the sulfhydryl groups, it's a precursor to glutathione. Could have them take reduced glutathione as well as methyl B12. And then just in the plain foods categories, free-range eggs, garlic, broccoli, cabbage, sesame seeds, butter, veal, lamb, avocado, asparagus. And then you get your good oils, such as the wheat germ oil, sunflower seeds, safflower oil, and almonds are good. They have high vitamin E, which is good for the cell membranes. Make sure you have a signed, informed consent. Yes? Coming to it. Yeah, because what we're going to be doing is this is just kind of the background, but then we're just going to go through everything that I do. Okay? So I'm just trying to break it down so you see the rationale and the CYA aspects as much as you can. Yes? I'm sorry? How long should they get what? Vitamin. After procedure, if they're actually traveling to get an intravenous vitamin C, it's as soon as we can get them in. But in my area, the patient is at least an hour and a half away from an intravenous doc. And so that's why I like the lipospheric, and we just give that right to them in the chair. I do the procedure as soon as they're done. Okay? How long did they say? I give them a dose which is equivalent. 3 lipospheric vitamin C's, which are actually 3,000 milligrams, are equal to 25,000 international units. Okay? And then if I have my druthers, I'd like them to take it for a good week afterwards. But again, you run into patient compliance. So I know that when they've had it done, at least I've seen them take those 3. Okay, the informed consent. This is an absolute necessity. Consult with your lawyer. Check state guidelines and rules. That has to be enclosed. Every state is going to have their differences. And now we come into the down and dirty and the nitty gritty, which is protect the patient, staff, and dentist. And then we'll go in the environment after that. Okay, and this is where I do need to get this working. Yeah, the batteries are killed, I think. They're not working. That's sporadic. Oh, you have another one? You're an angel, thank you. Lovely. Okay, so this is a biological and nutritional support. We've discussed that, and that's part of the patient preparation. And then we get into, so we've taken care of that. Then we get the patient in the chair. We use activated charcoal slurry rinses. We give them protective drapes and HGX, which is an HGX cream. So then we go on after that. They get their own alternate air, a nasal hood, not nasal prongs, eye protection. And then we've got the dental dam and cleanups, high volume suction and saliva ejectors, the cutting of the restorations in chunks as opposed to pulverization, and then the rinse after mercury removal with the high volume suction. So on your safer patient, you've got your standard protection, you've got the full patient drapes, full body, eye protection, dental dam, cleanups, a fan to make sure the air is flowing, a negative ion generator, a dental air vac, and a separate air supply. For the class 2 patient, which has some medical issues, your pre-treatment support, reduce the bioburden, clearance from their primary care health provider, and you've got to be sure to use the oxygen or fresh air mask, dental air drapes, and it's recommended to have a sauna or a detox bath afterwards. A detox bath is just a big whack of Epsom salts in a bath and just soak for 20 minutes, or as long as they can soak in a bathtub. The acutely or chronically ill, again, you need your licensed healthcare provider for prior treatment. Do not, as a dentist, please try to detox the patient. That's getting into the medical realm. It's going to lose your license. The patient needs to be cleared by their provider for the mercury removal. And in many cases, we get letters from the providers stating that they're clear and that they really feel for the best interest in the patient's health, that they request to have the amalgams removed. So the more backup stuff you've got in that line, the more it will help, hopefully, in a court of law. Because we always have to remember those factors. The patient's excretory organs need to be functional. And then again, negative ion generator, dental air vac, and the filtration devices. I've got pictures of them all. Pregnancy and lactation. That is a real touchy subject. So only do removal on an emergency basis due to existing or potential infection or pain. The fetal issues are particularly vulnerable to toxic insult. Amalgam removal should be avoided until the patient is postpartum and post-lactating. And basically they got to pump and dump for at least 48 hours after mercury removal after a precaution. And I tell my patients if they've had their mercuries removed, please do not get pregnant for 3 months at least, because you're still going to have elevated mercury levels in the blood and the urine. It takes a lot, because as you reduce levels in one area by removing the fillings, you're going to get the mobilization effects from other areas. So you always have to think of us as having homeostatic systems. They're trying to balance everything. So you're just going to get this rush from everywhere. And then you get arsenic and lead moving around as well. Basic armamentarium. We use a hood, then the rubber dam stuff, HGX cream, nasal hood, protective glasses, protective drapes. Okay, we'll come to that. Well, I'll tell you now. Originally, the HGX cream was the be-all, end-all. Okay, it's a sulfur cream, and so we would just have the patient put it on all the exposed areas. Did you hear the question? Okay, thank you, Mike. Basically, the question was, where do you put the HGX cream? So we would have the patient spread it all over the exposed areas, and then we'd put it on the rubber dam. And then we started running into having some issues with undiagnosed sulfur sensitivities. So then the patients would call back and say, my face is just in a mess. So we tend to use the HGX more for ourselves because we don't have my staff doesn't have the sensitivities. But, and then we just use a complete drape. We take a dental bib, cut a diamond in the center, and put the dam on, cover them up that way, and then put the nasal hood on. You'll see a picture shortly. So that's eliminated the worry about the HGX cream. But the saga is not over yet because we have some very, very interesting patients, and they get so claustrophobic they can't go through with the removal. And I've had them stop me mid-procedure. I can't do this. They're numb, they're draped, they're all ready to go. I'm ready to just pick up my handpiece, and they rip everything off their face. Okay? So those are the patients that need to have the sedation. Which opens up another ballpark, because then you have to decide whether you're going to, we've got our different sedation laws, and those are getting more complex all the time. And I don't use sedation unless it's just a script from an MD. I'm licensed to prescribe Valium, but I don't particularly like it. But that's about the strongest that I'll use. So, and that's just 5 or 10 milligrams depending on weight the night before or the day of the appointment. But even some of these patients that are so claustrophobic, they cannot go through it, yes? Yes. No, the absorptive surface out, the plastic surface is next to the skin. Next to the skin. Okay? Because you're going to get your splatter, and otherwise, if you have the plastic surface out, it will just drip all over the place. And then the less dripping like that you have, the better it is. Okay, and these are some special suction tips which are sold by the IAOMT, and they're nice. We'll use them on top of the rubber dam. We don't use them all the time, but they do enhance some of the suction just because of the way they fit. Some areas they don't fit that well. Okay, and then we've already discussed the HGX basically. And there's our activated charcoal rinse. So, and it's just a teaspoon of the powder, and the patient swishes it and then they swallow it. And that will pick up a lot in case some of it is absorbed or you get some leakage on the rubber dam. Yes? We do that. That we're coming to that in the lecture. But yes, that's very, very important. What I was just going to say it. He nags me all the time. He said important that after the removal that the mouth has to be totally irrigated so they don't swallow the charcoal after that point. You have to clean it up. And if you've got a nice clean mouth, it cleans up beautifully. You've got a patient that doesn't have such good hygiene, it leaves a lot of residue. It's a bit of extra work to clean it up. So there's your draped patient. That's a lot. But you can see why they might get claustrophobic. She's alive and kicking. Okay. All right, so you've got your rubber dam and it's all clamped down. There's a nasal hood. There's a dental bib underneath. And then that's a drape. And that helps hold everything down, the dental hood. Yeah, it's everything, right down to their feet. That? The drape is made of a it's not permeable. Yeah. Disposable, we have some that are just, that we do wash. You could, basically what they are when we use the disposables, and it gets to be a real pain, which is why we like to use the ones that we made, is they're surgical blankets with a plastic liner, and then you just have to cut them out that way for the neck.
There are many things on the market that your assistants will wear that when we go into surgery, they put it on as disposable. We wrap the patient in that.
Yep.
And then if your gloves are large enough like mine, when we take everything off, I hold it that way, take the rubber glove, and then we put it in hazardous waste. So they're disposable. You don't really want that stuff going into your community
Right.
wastewater products, and you want them disposed of as hazardous waste, because they are. That's another problem.
Yep.
You guys, the comment was, they're gonna incinerate it, it's gonna go in the air.
Mm-hmm.
That's the problem. Where else are you gonna put it? You're not gonna put it in your backyard. So we have
There's a dilemma.
waste container that's supposedly supposed to be disposed of properly, but that's such a waste problem.
That's really questionable that it is. So this is the patient without the dental bib on the face. Same type of scenario, but you see how the dental bib gives a much better coverage. But this is with the HGX cream, and this is a super claustrophobic patient. That is all they can do. Question? Okay, to absorb the particulates and vapors, you do need a high volume suction, and you need, you can either use an IQ dental air vac. This is for the air suction, okay? It's not for the water suction. Or you can use the Faust type of model. This is my office, and what we've got, this is the dental air vac. And the suction is so great on it that we actually have to put a hood on it to stop it from sucking up different, like the gauzes and whatnot that are in the room. Otherwise you get some good surprises. And then this is the one put out by Faust, and they should be here at the conference. And that is, you've got their larger version and their smaller one. And we've got, I don't have the Mars negative ion generator, but they're here at the conference as well. This is attacked, and this has little pins that are located underneath that grid. And then there's a wall collector plate. And basically there's a fan in here, and that flows right over the patient. And then the ion catches on the plate. The plate is just a solid plate. And they're easily cleaned because that is just wiped with gauze. And then there's 6 pins in there, or 8 pins, and they're just wiped with the gauze as well. And this is the alternate air supply. This is my creation. And basically, it's the yellow tank means it's scuba air. It's medical gas, just air. It's not oxygen. And then there are 3 controls on it for regulating the airflow. And then each of those regulators has a hose which connects to my assistant, myself, and the patient. And each one has separate regulators. There you can see a closer up shot there. But it's a nice way, and we replace the tank regularly, obviously, when it's starting to run low. But having the big tank makes it a lot easier as far as having to replace it all the time. Okay, another type of protection, and that is a respirator. You can see more pictures, visors, respirator. Everybody's draped, covered. After the mercury's removed, the dam is removed from the patient's mouth. The patient's mouth is rinsed for at least 45 seconds. That's the first thing you do. Dam's removed, clamps removed, and that's it. Nothing happens until that's done. Then all the draping is removed. The patient's face is washed with soap and water to remove the HGX cream if that's been applied. The patient leaves a room after they have a post-op mouth rinse, and we give them 1 capsule of NAC, N-acetylcholine, mixed with vitamin C powder. And then the instruments and rooms are decontaminated, and we do an entirely new operatory setup. We do not renew the patients, the instruments at all, or reuse them. So there's a combo. Okay, 1 capsule of 600 milligrams and a teaspoon vitamin C crystals. Just mix them up in water, have the patient swish and swallow. No, we don't. That's actually not a bad idea. My assistant, yes, he asked, and it's a wonderful question. He said, do you reuse that room or do you move to an entirely new room? And we reuse the room because it does give, the benefits are it gives the patient a break. They're tired after having been open. Sometimes it's not very long, but they're very tired. There's some emotional impact with the mercury removal because they just take their health very seriously. Yes, go ahead. Yeah, that's.
I know you can hear me if I speak loud. Because I can project. I bet the camera can hear me too. And right now we're in the middle of doing some research where we purchased one of the vapor sniffers and it's going around to several different offices. And we want to know where is the mercury vapor the highest, under the dam, above the dam. The readings are taken at specific times before the amalgam removal, after the amalgam removal, even several minutes afterwards, because we're trying to figure out when is the room safe for everybody to take off the equipment. And so we hope to have that information. Actually, the readings have been coming back very good. What I'm actually going to have to factor in is I'm going to have to find a non-mercury safe office and take readings in their office to see how different we are. But so far, the 3 offices that it's made it to have come out really good. So I didn't mean to interrupt you, but I had a partial answer to that.
Yeah, so that's kind of exciting new research. What we do is we just keep everything running while we're doing that rinse, so we know we've got at least, and our rinse are probably a good minute and a half. but you've still got the dental air vac going, the negative ion generator going, so it's sucking a lot out. So mercury vapor, it's very, very labile. It moves very quickly. The ionizer's on 24/7. I don't even, well, the tact I don't think you can shut off. You can shut the fan off, but it's still running if it's plugged in and turned on a little right. Yeah. Well, but why bother? It's another thing to unplug. Okay, mercury containment products. So you've got the Mercon wipes and the Mercon spray. This is wonderful smelling sulfury material, but it does decontaminate. My assistant hates it with a passion, the smell of it, but it is what it is. Mercon's also put another product out, but I'll tell you about that after because it's coming up. There's a lipospheric vitamin C. It's put out by Live On, and we use 3 packets of that directly after the mercury's removed. I'm sorry? The only, I think you're coming to the, is there any medical concern for not using it on the patient? I think what you're alluding to is a glucose 6-phosphate dehydrogenase issue. And that's with the intravenous vitamin C, as far as I know. I think with the oral form, that has not been shown to be significant. I haven't found anything on it. So I don't think there's any medical reason not to. But then you've got some patients, they've got their allergies to everything. So it could be the flavorings or whatever. So that's a test thing. Life's always a challenge. So for the staff, we're basically talking about the same stuff. You know, they've got their alternate air that we've got built in. They've got their gloves, HGX cream, their protection, their disposable covers, the air filtration and ionization. And then basically the suggestions that I have for my staff are very similar to what I give the patients. And then they've got the instrument decontamination with the Mercon products. The OSHA, well, exposure limits for mercury are listed here. The OSHA PEL has an 8-hour limit of 100 micrograms per centimeter cubed. NIOSH, the time-weighted average is 50 micrograms per meter cubed. The NIOSH ceiling is 100 micrograms per meter cubed. The American Conference of Governmental Industrial Hygiene is 25 micrograms per meter cubed over 8 hours. EPA limit is 4.8 micrograms per day. And then I did include the Canadian limits, which are 0.025 micrograms per meter cubed for 8 hours, not to exceed 0.15 micrograms per meter cubed. Mercury vapor is absorbed through the skin at a rate of 880 to 2400 microgram per centimeter cubed, with a 27 to a 43 minute exposure. The blood levels after this kind of exposure are ranging from 216 to 844 milligrams. Particles less than 10 micrograms are inhaled during amalgam removal. Hence the reason why we need to have respiratory protection. Rat studies have been showed that inhaled dust is immediately absorbed. Heart levels of the mercury are 81 times greater, the control within minutes. In the brain and the liver, you've got greater than 7 times the control within 16 hours. Kidney levels rise slowly, but they do remain high longer. So these are figures from IAOMT data over the years. Just what you get with a procedural exposure level. Opening an amalgam capsule after it's been triturated, you get from 40 to 1,000 micrograms per meter cubed. Opening a chairside trap, and this is significant because we have to do this still, you get 600 micrograms per meter cubed. A high-speed cutting amalgam dry gives 1,200 to 4,000 micrograms. A high speed with water cuts that down from 100 to 460. Hence the need for using copious water irrigation where you're cutting out amalgams. And for hygiene, dry polishing or even with your prophy paste of mercury fillings, 500 to 900 micrograms. Significant. So here are the rules. Respirators must be worn if the ambient concentration of mercury vapor exceeds those prescribed levels. Workers should only use respirators that are approved by NIOSH and MSHA. They need to be approved by ANSI, and there's the rule numbers updated in 1992, and the NIOSH rules. Do not use regular masks. Please. Your normal face masks will not protect you against mercury. The particulate matter lodges in the filters and the masks, and the vapor release enhances just the water and the moisture and body temperature. That's where mercury vapor is mobilized. It's a body temperature. So this is an example of a half mask put out by IAOMT. I can't get my staff to wear full face masks. This picture has an error. So hopefully you can find it. Yeah, mask under the mask. Yep. So here you got wonderful protection. And then you got that little mask that's absorbing water. So that's going to go right in underneath it. Totally negates what you were trying to do. Next, time to save the environment. So we want to reduce the extra mercury exposure in the operatory. So the issue are the vapors and the particulates. So we use the dental air vac, air filtration, and the negative ion generator. So this is a really nice unit. I've got the one with the ultraviolet, which takes care of viruses, bacteria, and funguses. Basically, I'm just giving you a listing of where you can get this equipment. And we've never had any repairs. The only things that we've had to do with these units are replace the filters. So OSHA requires, and this is just something to keep in the back of your mind, it requires that employees be given written informed consent before the use of any toxic chemicals. Women of childbearing age should have no more than 10% of the OSHA MAC, or the threshold limit of 100 micrograms per cubic meter. And pregnant women should not be exposed to mercury whatsoever. NIOSH recommends annual monitoring. We have not been pushed on that issue or this issue. I don't know what's going to be coming up in the future with EPA. We've had some changes, and some of the rules which were coming up are being placed on hold. You need to train the staff. This is necessary to be aware of the potential sources of the mercury. You need to train them to take caution with handling the scrap. And that includes the scrap that they might, well, we don't use it, but you're still going to get it in your traps. And the Mercon people do put out something called Mercon gel. I've got a slide on that. And you can put that through the traps once per week. Decontaminate those instruments before they go in the autoclave. They need to be wiped down with a sulfur-containing compound, or you're going to be exposing everybody in the office to mercury vapors. As soon as that equipment heats up either in the ultrasonic or it heats up in the autoclave, it's going to zap those levels up. Have toxic management waste practices for the contaminated drapes and disposables. And then hopefully your hazardous management people will be doing the job correctly. Don't take it to laundromats or whatever if there's laundry, because you're going to be contaminating their air. Recommend good biological support for your staff. Get them taking the good quality multivites, their multi-minerals. This initiates blood chemistry changes. They should be taking magnesium between 400 and 600 milligrams per day. Take their vitamin B6s. Take their zincs. Vitamin C will tend to deplete the body's zinc excretion. So that's the rationale for the zinc supplementation. And then encourage them to take their vitamin C, their selenium, alpha-lipoic acid, and these other things. And then encourage them to eat healthily. My staff eats like crap. They do. I'm shocked. One pizza lasts for lunch a week. And then Kentucky Fried Chicken, mashed potatoes. I think it has gravy. That's another delicious lunch. Or the best lunch, noodles and Velveeta that can be melted on the noodles in the microwave. I mean, these are issues. You can only encourage the staff. You can't change their lifestyles sometimes. Whew. That's a true story. I don't watch what they eat for lunch anymore. I just can't take it. So then we've got reducing the mercury exposure in the environment. And some of these are laws. The mercury separators, that's up in the air a little bit. If you look at it universally in the United States, and then you've got the mercury recycling. And this is Northeast Ohio Regional Septic District. And that's what well, again, it's an old figure, but 41% of mercury in the septics coming from dental offices. That's a pretty scary figure. It's since modified somewhat because a lot of the newer grads are using composites. So some of that amalgam scrap has been reduced because they're not using as much mercury. Okay, and then we've got the amalgam separator rule. And right now, okay, basically it passed, and with the new Congress and everything else, or the new regulations that came out, that was supposed to be effective, I believe, this coming July. It's been placed on hold. No. But that's because Trump eased on the regulations. The new regulations that were not signed into law. And that one didn't get signed into law. I think it's going to go through. Who knows? But there are some issues with the amalgam separators, and I would, if you don't have one, I mean, the state of Maine, it was law in 2004 that we all had to have amalgam separators, but there are some issues with the different amalgam separators, and check the standards. No question. But there's some standards that they believe that the results were fudged. So you need to check the efficiency of the amalgam separators. And with the new law, they're supposedly grandfathering the people that bought the older amalgam separators. So in the earlier days, the efficiency had to be 95%. Okay. And one company did claim the efficiency to be, I believe, 98.6%. The new standards are 99%. The separators have to be totally enclosed in compliance with the different state DEPs. You need to have written recycling contracts with the recycling facilities, and you get your EPA ID numbers. And this is the one that has some questionable research. Yeah, I actually called the Solmatex people on this because their recommendations are to change them every 6 months. And then I talked to a rep and they said, oh no, if you're not placing amalgams, they're going to run, your filter will be good for a year. There is the level. Yeah. Talk to the Mars guy. Yeah. I can interject something there though, because when our law first came in to place, the EPA actually came around and checked the installation and everything else. So because you have to keep your records of when you've gotten rid of the filters, you do have to have proof there. But the interesting thing with the EPA guys, they knew nothing about mercury. I offered to give them a little lecture on it, and they weren't interested. But, this is the stuff that they're responsible for. So I think once everything gets sorted out, and it's been a long time, I mean, we're talking certainly in Maine over 13 years, I've only seen the EPA once. And I think down the road, hopefully there will be some more regulation, even if it's just presenting the documentation of when you did your filter changes. So I think that's the important thing. Keep that documentation forever, because that's only going to be your only line of defense. So there we go. You've got the copies of the transport records, copy of the contract with the recycling facility, an inspection sheet dated and signed to ensure the unit is working properly. That's what we do in our office. And then we have the ADA mercury recycling, salvage, store, and recycle.
Okay, go ahead.
Okay. So any scrap should be in a wide mouth container covered with water. And that's a contact amalgam waste, and you have to negotiate the contract with your recycler. Any teeth that you extract that have mercury, that's also mercury scrap. When you're cleaning your lines, do not use any chlorine in those lines because that will really mobilize the mercury vapors. And use disposable chairside traps, because you'll remember 600 micrograms was the amount of mercury vapor that was released just from opening that stupid little trap and cleaning it. Mercon gel will actually pull out of your suction system. Use it once per week and it decreases the release of mercury from the lines and in the evacuation system. So I think that's a really good idea. You can just actually suction it right up through your hose, so you're not having to open it up for that. And it's a sustained release of a surface active formula. What we do is we use our line cleaners, and then we give them a really good rinse with water. Okay, and then that's the topping on the dressing at the end of the week. So that's just left in there all weekend. And then it can perform its magic over a longer time period than, say, doing it on a Tuesday line or a Monday, and then Tuesday we sit there and contaminate the lines again. And then again, hazardous waste management, that's all contractual stuff. These are guesstimated costs. $311 per 2-gallon container, the elemental. But, you wouldn't even have any of the elemental because you're not placing mercuries. And that's just general other costs. So operatory setup costs, negative ion generator is about $1,860. You've got your HEPA filters for the UV. That's the little air purifier. That's $719 to $910. Your big shop vac dental air IQ being the most expensive, it's $2,500, ranging down to $900. An amalgam separator, $1,000 and up. And then the Mars amalgam separator they pull the tanks away, and your contract takes care of a lot of stuff. Whereas with the Solmatech, you have to take the canister out, UPS it, and you send it to the recycler. And then respirators, you need at least 2. Your readometer, or for measuring the galvanic currents, run from $850 to $1995. And then my separate air supply unit, I had that made at the compressed gas place, and that cost probably about $2,200 to have all the fittings made and everything completed. Can ask me all kinds of questions. The vitamin C crystals, yeah. No. Okay, remember, you've done the charcoal rinse, then they're clean, equipment's removed, they're given the NAC vitamin C to rinse with and swallow. Okay? And so they're getting about 1,000 milligrams, but if it's a different formulation of vitamin C. And then when everything is all done and they're back in the clean operatory, then they get the lipospheric vitamin C. I try to do that as close to the end of the procedure as possible. Yes. They're the same. Yeah, they're fat soluble, and it's because of, are lipospheric and liposomal vitamin C the same? Apparently they're fat soluble, and it's because of the phosphatidylcholine in them. Yes? I give 3 packages of 1,000, and 3 packages of the 1,000 live on are equivalent to a 25,000 vitamin C IV. Don't do it before you. So Live On said you should be using 5 packets before. Yeah, so 5 packets before and 5 after. 5 packets before will interfere with the anesthesia. Why would you do that?
So the question stands when a patient says, okay, I found out that I have mercury fillings and I'm going to go get my amalgams removed.
So my first reaction is stop, let me check to make sure that you're going to be safe to be able to have those mercury fillings removed. So we want to refer them to a mercury safe office like I talked about earlier. We want to make sure that we get the person prepared for that, and that the office that they're going to can do things like sequencing with the readometer or some kind of galvanic meter to be able to check. This is one of the forms that one of our members has in their office. Dentists are not the person responsible for preparing the person for heavy metal removal out of their body tissues. Dentists are taking out mercury fillings. So if you're not in the business of preparing the person's body for mercury removal, and you are not going to be doing the chelation afterwards, your patient doesn't understand that. They think that once they have the mercury fillings taken out, the mercury is out from everywhere. And so this was just something to absolve that particular dental office from having to do all the work that either a naturopath or a chiropractor or an MD or an ND would be doing for the patient. So in this particular instance, it basically says you are working with someone that will be preparing your body for mercury removal and will be handling the chelation afterwards. Who is that person? So that they then sign and they get it, because I don't know how many times I've heard, well, no, I don't have any mercury anymore because Dr. So-and-so, who's a dentist, did all that, and they just don't get it all. So when I say preparing a person for removal, I mean looking at the excretory routes. So the way I explain that to a patient is, if I told you to go home and clean your bedroom and get all the dust bunnies out from under the bed, and all the paper clips that you could find on the floor, and any toenails and everything else that had been trimmed and cut, and while you're gathering all that together, I'm hammering the doors and windows closed. Well, you will be able to move that trash, but you won't be able to remove it out of the body. And so when I say the excretory routes, I'm looking at the lymphatics, the lung, the large intestine, the liver, and the kidneys as your routes for getting things out. And so I don't care if it's with muscle testing or with whether it's with EAV, we look to make sure that those routes are good. I personally like to make sure that the person doesn't have an MTHFR flaw, and most of the time I can look at their traditional labs and get an idea if they are. If they are, then I'll put them on some kind of a methylated B and a folate. If they need lymphatic drainage, I might use some homeopathic remedies for them, get them drinking more water. All those types of things are helpful. And then we talk about what the chelation is going to look like afterwards. They don't have to do the heavy metal testing on the front side if they don't want to. They can go ahead and go through their mercury removal. But I try to stress to them that taking the amalgams out of their mouth does not get anything out of the body tissues. And you'll see that in just a second. And so basically I call that a bathtub effect. And so if this were a bathtub instead of a sink, and you were sitting in the bathtub and you said, oh my gosh, the water's about to overflow. Dawn, the water's about to overflow. And I'm talking to you through the door and I go, okay, well, dummy, turn off the water. That's the source, which would be your amalgams. So I'm going to remind you that every single time you chew, every single time you brush your teeth, every single time you drink anything that's hot, like hot water, or something that's cold that's acidic, so iced tea, lemonade, orange juice, coffee, all those things make the mercury come off of the filling. The analogy that I use, and I still think you can find it on YouTube, years ago Tom McGuire put on a little conference and he videotaped it and threw it up on YouTube. What he did was he took a tooth that had an amalgam filling in it, and then he took just a vapor sniffer and measured the amount of mercury coming off of it. And it was like 0.06 micrograms per cubic meter. It was really, really small. So when you look at the fact that the government says it could be 100, and that was 0.06, that's really small, right? But then if you take a toothbrush and you go over the top of the tooth twice, really, who brushes their teeth and just goes, ch-ch-ch-ch, okay, I'm done? Well, I actually can find a couple people that, my son's probably one of them, but most people get in there and they really scrub. But if you just go over the top of the tooth twice, that reading goes over 200. So what in the heck do you think happens when a dentist puts a dental burr to that filling? It's going up into the 100,000? We don't know. I'm going to remind you that if you break a mercury thermometer and you swallow it, which would be a really stupid thing to do, I would suggest you not do that. But if you did, you would pass 80% of that mercury. You would only absorb 20% of that mercury. But when you breathe in mercury vapor, you breathe in and you store 80% of that. It's the most hazardous form of mercury. So I try to explain to them that if they turn off the faucet, that stops the flow, right? So taking the amalgams out is going to stop, not getting new vaccinations stops the flow of new sources of mercury coming in. Pulling the plug is doing the chelation, which is done afterwards, which is why it's so important that it's a dental office and a team for support. Can't just be the dental office. You can't just be doing this all on your own. You've got to have a physician and a naturopath and a chiropractor. And the chiropractor comes into play even when we're talking about the bite. How many times have you done crown work on somebody and then the bite is off, and then they go to the chiropractor and they get adjusted and they come back and their bite is off, and then they go back to the chiropractor again and you guys are fighting against each other? So you need a chiropractor in that team. Okay, when we're opening the excretory routes, that is just what I went over. I'm so into it. It allows you to be able to throw the trash out. And so again, it's not the moving that's an issue, it's the removing. People who have MTHFR, we can get most anything to move heavy metals from the inside of the cell to the extracellular space. The hard part is getting it from there into the potty, which is why those people get so sick. MTHFR people, when you try to chelate them, they get really sick. They call you and they complain bitterly. I don't feel good. I can't work, because you've mobilized so much of that heavy metal, but then it just sucks right back into the cell. So that's what I'm talking about, the mobilization versus the ability to be able to detoxify. So let's look at a couple of heavy metal tests here so that you kind of get a snippet of what goes on in some of the people that I see. Let's look at this one. It is a pre-DMPS challenge, and you'll see that my let's see if I can get this to go. Yeah, how did you get this to go earlier? Well, I am pushing the button. Oh, that one. I knew that. Okay, here's my mercury level is just right there, which is just negligible. But then it's a provoked. So I try to explain what the provoked urine test does. I tell them in the case of DMSA, you're going to take some DMSA orally. It's 4 little capsules that you're going to take. They're like swallowing little guns. Those little guns go into every cell and say, this is a stick up. If you got heavy metals, dump it. You collect 6 hours worth of urine and we find out what you have. Then the patient gets what's going on in their body. So you really want that provoked test. This is after doing 5 months. So let's go back here. We see where we are right here. And they've been chelating for 5 months and now they're here. That's not the fastest that I've ever seen. So what about a hair test? Okay, I do have my patients do a hair test. Your hair is a trash can. If your body is working correctly, we will see mercury in the trash can. Now you can get some artificial stuff, so you need to make sure there's no coloring. You need to make sure that there's no hair product on there, that you don't have perm solution or anything else. But it is not the way to tell if they have heavy metal poisoning. So if somebody comes in and says, oh, my chiropractor or my naturopath already did a hair test, I don't have mercury as an issue. That is not a good thing if mercury did not show up in your hair test and you have amalgams in your mouth. That means that your body's probably not processing it correctly. But there are some other clues looking at a hair test. I don't do a traditional hair test. Sounds weird if I say that, right? The regular heavy metal hair test. I do a toxic metal panel so that I get a better picture. But if you're looking at the regular hair test, the calcium level might be really high. That's another marker that there's mercury in there. Okay, the excretor. This is the way God made your body to function. Look at this hair test. Now, if I tell you this guy's story, he comes in, he has 18 amalgams in his mouth currently. He has absolutely no health problems. Matter of fact, he swears to me he's never seen a doctor in his entire life, other than when he was born. That's what he says. His wife had some amalgams removed. Her chronic fatigue miraculously went away. And so she's been on him like stink to get his fillings taken out. He goes to his dentist. He says, my wife wants my fillings taken out. Dentist looks in his mouth and says, why? They're completely serviceable. There's nothing wrong with them. Why would you want your fillings taken out? That's stupid. You just want to sit in the chair? Does she not like when you open your mouth? She doesn't think it's pretty? And he said, I don't know, some kind of health problem. I don't know. So he leaves. Goes home, talks to his wife. She goes crazy. He comes to me and he says, look, what I need is you to get my wife off my back. That's why I'm here. I have no health problems whatsoever. I don't want to get my fillings taken out. And so I said, okay, let's look at your lab work. We looked at blood work. We decided to go through with heavy metal testing. And this was his hair results. And so when I saw the barium this high, I went, wait a minute. You told me you'd never seen a physician in your life. You never had testing done for an ulcer? Oh, yeah. When I was going through law school, they thought I had an ulcer. And so I had an upper and a lower GI. And I said, okay, you're still processing out the barium that's in there, but I don't know another way that you would get barium that high. So now that I know you're a lawyer and a liar, we'll go on with the rest of the test, other than your wife. Okay, so this is his heavy metal test. This is the provoked test. Look at his mercury level. So remember, go back to his hair, see where the mercury level is here. So he excretes it. His body recognizes that mercury is poo-poo and it's throwing poo-poo out in the hair, which is the trash can, right? So his body is working as God intended. Okay, you can keep your mercury fillings. I don't care. What? No, I've been online and this causes neurological problems. I said, okay, go get your fillings taken out. Well, no, you don't understand. The truth of the matter is I'm scared to death to go to the dentist. I don't want to sit in the chair all that length of time. I said, okay, then we need to find somebody for you that can put you out and you can get it done. Now, ideally, I would want you to have it done by a mercury safe dentist. But your body is working as God intended. And so, you know, if you get a hit of mercury, it's going to process it out. Now, it would be stupid to get that big of a hit of mercury, but if that's what you want to do, I'm not going to tell you no. That's only with an excreter. Now, we look at this person. This is the hoarder, like me. Now, you look at, this is the hair test. Again, in particular, I want to look at the lead and the mercury. This would be a perfect example of somebody having a hair test done, bringing it into me and going, no, I don't have heavy metals as an issue. I'm not having my fillings taken out. Okay, this is not good that this is showing up this low. This is the same patient. This is the provoked urine test. What do we see is high here? Lead and mercury, right. And so what you need to know is that, you know, somebody's job somewhere as a scientist is to take 100 little rats and give them a dose of something until 50 of those rats die. It can't be an accumulative dose, so each day you throw those rats out, get new rats, give them a higher dose. And when you get to the dose that kills 50, now you have the magic number, the LD50, right? If you give the LD1 of lead to the rats, none of them will die. If you give the LD1 of mercury to the rats, none of them will die. But if you mix the LD1 of mercury and lead together 100% of the time, 100% of those rats are going to die. It's the most neurotoxic combination known to man. Now I'm going to tell you, this lady had just recently been diagnosed with MS. I don't know whether she had MS or not. What I see is heavy metal poisoning. And so here we want to get connected with a practitioner that's going to be able to help her. But she has 3 amalgams left in her mouth. 3 occlusal amalgams. This is her after having her amalgams removed. What happened? Yeah, she didn't have any precautions taken whatsoever. Even though I sat with not only her, but she brought her husband back in and we went through the whole thing all over again about why they couldn't use their insurance because they weren't going to be able to find anybody who's going to be able to provide the level of care. This will take 30 years or longer to get out of her body. Is not going to happen in her lifetime, and I refuse to work with her and send her to somebody else. It is not going to happen. She went from walking with a 3-prong cane to being in a wheelchair immediately within this procedure being done. I cannot stress to you the importance of not just sending someone out to go have their amalgams removed unless they're going to be prepared and they're going to see someone who does safe removal, which is you guys. This is my husband. Everybody knows my husband. He's walking around here all the time. Years ago, well, Toby was raised in Chicago. Not like that, that's really important, but he was raised across from Wrigley Field. I don't know whether he was raised someplace where they had lead pipes or whether they had lead paint on the walls or whether dishes he was raised with had lead paint. It doesn't matter. At some point in time, I noticed that he was reading the paper and he had this tremor. And so I said, oh, I'd really like to do some heavy metal testing on you. And so I ran this very first panel. You can see the date on here is October 1 of 01. And you look down here and lead is not supposed to be higher than 2 and it's 24. So that's kind of off the chart here. And so I decided to do some chelation on him. I used a product that had EDTA, and you can see here that by December of that same year, wow, we're talking about what, 6 weeks here? He is now at 0.3. So I'm going to ask you, because we didn't know anything about excretors and hoarders then. Is he a hoarder or an excretor? He's an excretor. His body works as God intended, and boom, it was just coming out. And so I stopped. You know, the tremor went away, everything was good. And so I already told you my son is Asperger's, and if you know anybody who has a child that's compromised like that, you guys, the whole family is going through family counseling on a continuing basis because it just drives you crazy. And so we had gone through a family session, and I was having I'm not going to even call it a disagreement because I was right, but we're having a conversation, and he's doing this. And I'm thinking, dang, that last session, that was a really good one because he's not only agreeing with me, but he's got eye contact and his toes are pointing. I mean, that is good. Okay. And then I started preparing dinner, and I noticed that he was watching TV from the side, and I saw his head doing this. And I went, oh, shoot. He probably wasn't even listening to me. So we did heavy metal testing again. And so the date here, we're looking at April 22nd of 2012. And we drop down here and we see, oh, bismuth. Wow, 770, and it's not supposed to be over 4. What is your main source for bismuth? Pepto-Bismol. And so I said, Toby, are you taking Pepto-Bismol? Maybe. Maybe. You either are or you are not. Yeah, I'm taking it. I said, how much do you take? Some. How much is some? I don't really know. I said, well, how often do you buy it? Oh, I get 2 of the big bottles every week. I said, oh my gosh, seriously, do you have a pink fetish that I don't know about? I mean, are you like pouring martini glasses at night and chugging this? He was doing just that. He was not pouring it in martini glass, but he was opening the lid and he was just literally chug, 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 chug. And that's what he'd do every night. Why are you doing this? I think if we eat too late, sometimes I might get indigestion. Now, you have to know that both of us flew around the world as flight medics. And when we were going out of the country, they would tell us to prophylactically use Pepto-Bismol. But somehow, between hearing that and the fact that it's over the counter, I guess he thought it was just safe and there was never going to be a toxic level of it. But there's a toxic level of everything. So we chelated it out, and what you'll see here is it went from 770 to 17, and then it dropped down to 5.1, and then it went back up to 120. What do you think he got back into? Yeah, even though we're still chelating. So that's when I said, okay, you know what, I'm done. Because obviously I care more about this than you care about it, and that's just not working out for me. The thing that I did see that was interesting is you look at the lead here, it went back up to 7.7, it went down to 6.8, it went down to 3.7, and then it went back up to 5. I can't tell you that Pepto-Bismol has lead in it. I don't know what it is that makes maybe the lead come out of the bones, but it is interesting to me that that happened during this process. Okay, so I think that what I want to do here is I want to stop for the morning, and then we're going to go ahead and eat lunch, and then we'll come back this afternoon and we'll pick up right from this point. And of the 3 of us that have been speaking this morning, please feel free. We want to be your best friends. I am very sincere when I say feel free to email me. Just put in the tagline, you know, I'm a practitioner, I have a question for you. I will never turn you down. If we need to make time for a phone consult, we will. But